Welcome to Module 6. We will look at the latch and the transfer of milk from mum to baby in greater detail. This image shows a baby latched deeply onto the breast. You can see that the nipple is far back in the baby's mouth at the soft palate. To get a better idea of this concept, and for those who learn best by doing, try this. Press your tongue to the roof of your mouth, just behind your two front teeth. That's the hard palate. Often when we have a shallow latch or women tell us that breastfeeding hurts, the baby has the nipple compressed against their jaw and the hard palate. Next, slide your tongue all the way back, still touching the roof of your mouth. Can you feel how it changes from the hard palate to the soft palate? You will see in the picture that the nipple is back at the soft palate, not compressed or pinched, and baby is applying pressure to the breast tissue between the hard palate and jaw. It is breast tissue that contains the milk, not nipple tissue. When babies go through the effort of suckling, but do so on the nipple, not only does it hurt and damage the nipple, but also doesn't provide them the milk they need, yet babies still get tired from the effort. Let's watch this video from Healthy Families BC to learn more about the latch and successful breastfeeding. At the end of this module, you'll also find a list of resources, and there's another excellent video on latch by Global Health Media entitled Attaching Our Baby at the Breast for more information.
Latching your baby. How the baby latches to the breast is important. Regardless of the position used for breastfeeding, your baby should be tucked in close, tummy to tummy, and chest to chest, with her head tipped back slightly. Some babies can latch or attach to the breast all by themselves or with little help. Other babies need more support. With your baby's chin against your breast, direct your nipple towards your baby's nose. Gently tickle the baby's mouth with the breast, lightly brushing your breast back and forth. This encourages your baby to open her mouth. When your baby opens wide, bring the baby to your breast, keeping your nipple high in her mouth. If you are having difficulty helping your baby feed at any time, try putting her skin to skin while you lie back supported with pillows. This mother is laying back with her baby between her breasts. The baby's body is moving towards the breast, with her face moving back and forth until she finds the breast. She then opens her mouth wide enough to grasp a large mouthful. This is often how babies latch the very first time they feed. The size of your breasts can also change how you help your baby latch. This mother has larger breasts. She uses her hand to support her breast to make it easier for her baby to latch. She keeps her fingers well back from the areola so that her baby is tucked in very close to her. This mother has smaller breasts and does not need to hold her breast for her baby to latch. Watching your baby's feeding behaviors will give hints as to how well she is feeding. Once your baby has latched, she will start to suck. After a brief pause, the rhythm of sucking changes. The movement of the chin and jaw get noticeably bigger, and the muscles by your baby's temple move. Listen for your baby swallowing. You may be able to hear a caw sound. When your baby is feeding well, there will be several bursts of sucking and swallowing. This baby is not feeding well. He continues to suck with small, quick movements of his jaw and with very little swallowing. This means that he is not latched well or is too sleepy to feed. When your baby is finished feeding, she will let go of the breast and appear content. Your nipple should look round and pulled out. It should not look flattened or squashed. A misshapen or damaged nipple usually indicates a poor latch. This may cause the nipple to get increasingly sore and may prevent a damaged nipple from healing. Other signs that your baby is feeding well include enough wet and poopy diapers and being content after most feedings.
Start with you and baby being tummy to tummy. When baby's ear, shoulder, and hip are all in a line, it is easiest for baby to latch deeply and feed. When baby is placed nose to nipple, gently touch the baby's upper lip with the nipple. Then aim the nipple high into the baby's mouth. Wait for baby to open mouth wide. You may have to repeat this a few times until you get a wide open mouth, then bring baby in close. Baby's chin should be deep in the breast and nose away from the breast. Once the baby is latched on, the baby will begin to suckle. When the nipple is deep in baby's mouth, this will feel more comfortable and prevent pinching or rubbing of the nipple. A deep latch will also allow the milk to flow more easily. In our next video, we will be learning about drinking and milk flow. Note that the baby in this video is much older than 5 days. Between birth to day 5, you may not be able to hear as many sounds of drinking as in this older baby.
This baby is latched on and is now starting to suck. When she starts sucking, her sucks are very sort of fast and light at the beginning, and that helps to bring the milk down a little bit faster. Once it comes down, her sucks will start to get deeper and stronger and slower. This is called the letdown reflex. The baby sucks will then become slower and stronger in response to the increased milk flow during the letdown. To really know that she's getting enough milk is when you start to hear the swallowing. And again, you're looking sort of at her jaw, even on her throat. It'll start to pause and stay down, and that's when you really notice she's swallowing. You'll actually hear a k, k noise. And again, that's a great indication. You're going to have several letdowns throughout the feeding. If you're wondering how much milk your baby is drinking at the breast, one way you can tell is by watching how well your baby is swallowing. If you notice that she does start to slow down with her swallows, or if you don't hear or see any swallows, it's great for you to do a breast compression, which is when you hold the breast for a few seconds, 2 seconds, and release it. And again, you want to make sure your hands are back.
Many parents wonder if their babies are getting enough breast milk. Healthy babies who are fed according to their feeding cues will take enough breast milk. In Module 5, you can learn more about babies' early feeding cues. When the latch is deep and comfortable, babies are able to more easily remove the milk by sucking. There are additional videos and information on latching in the resources section for these modules. You can also tell that good milk transfer is happening when you see babies swallowing regularly, and you might hear it too. Listen for a k sound, as this is often heard when babies swallow milk during the feeds, particularly after the first 5 days. Another important way you can tell that baby is getting enough is that the wet and dirty diapers are constant and increasing daily in the first week. A good rule of thumb in the first week that there are as many pees as how many days old baby is, and poops increasing to about 2 to 3 per day. For example, by day 6 of life, your baby should have at least 5 to 6 wet diapers and 2 to 3 poopy diapers in a 24-hour period. Some other signs you may see when feeding is going well are that your baby looks relaxed and content and happy after breastfeeding. You may notice that their once flexed arms and clenched fists are open and relaxed when they are full after a feed. Some women notice that their breasts feel less firm and more comfortable after feedings. Babies that are getting enough breast milk will often have a strong, loud cry when unhappy, like when you are changing their diaper. The inside of baby's mouth and tongue of a well-fed baby will be wet. Your baby will be gaining weight. It's helpful to know that some weight loss in the first few days is expected, with baby starting to gain weight by the 4th or 5th day and being back up to birth weight by 10 to 14 days. In summary, breastfeeding is a natural activity, but also a learned skill with these key concepts. A deep latch is key to transfer the milk to baby and to make more milk. The nipple needs to be deep in baby's mouth at the soft palate to make milk flow. Feed whenever you see signs of hunger, such as moving lips, hand to mouth, turning head side to side. Hold baby tummy to tummy securely close to your body, facing and touching your baby. Neck, ear, shoulder, and hips of baby should be in line. Wait until baby has a wide open mouth, Lightly touch the nipple to baby's upper lip until a wide open mouth, then quickly bring baby to you, not you to your baby. Watch for the jaw to drop with swallowing. The latch should be comfortable for you, as ongoing pain during the latch could indicate a shallow latch. If you have any questions, be sure to talk to your doctor, midwife, nurse practitioner, or call 811, which is available 24 hours a day, 7 days a week, or call your public health nurse for support. Be sure to check out these helpful links and resources on the webpage for this module to learn more. The next module is about baby-led feeding and positions to make the breastfeeding experience more comfortable.